Good morning or good afternoon, everyone. My name is VACCINATED, and I'm the Director of Research at the National Center for Health and Public Housing. And I would like to welcome you to the final session for AMIGAS, the Cervical Cancer Prevention Program Learning Collaborative. This learning collaborative is designed to provide guidance on an evidence-based bilingual health education intervention program that's designed to train community health workers or promotoras to increase cervical cancer screening among Hispanic women. Next slide, please. The National Center for Health and Public Housing is, the mission of the National Center for Health and Public Housing is to strengthen the capacity of federally funded public housing primary care health centers and other health center grantees by providing training and a range of technical assistance. And we do that by doing research and evaluation and outreach and collaboration. Next slide, please. So at this point, you're probably familiar with how to ask questions, but I just wanted to briefly remind you that this is a live video session, and we are recording the session, and we'll plan to have the slides and the recordings available on our site after it's over. But because we are recording, we've muted all of your lines. We'd like to encourage you, though, to use the chat function to ask questions or make comments throughout the session, and we'll have a formal Q&A at the end where we will review any of the questions that were made through the chat. You also have the option to raise your hand and ask a live question, so you just click on the raised hand icon and we will announce when the line has been unmuted so you can ask your question. Next slide. I'd like to introduce our speaker for the session today, Dr. Jose Leon. Dr. Leon is the Chief Medical Officer at the National Center for Health and Public Housing. He has over 25 years of experience developing prevention and public health programs for underserved communities in the United States and abroad. He's had many roles during his career as a physician, a program manager, medical call center manager, health center manager, medical advisor, and senior health information specialist. Dr. Leon has extensive experience researching and assessing the healthcare needs of low-income populations and health center programs, and providing evidence-based solutions to urban and rural clinical sites in areas such as telemedicine, value-based care, and emerging medical issues. Dr. Leon coordinates learning collaboratives on cervical cancer prevention and diabetes management for health centers that are located in or immediately accessible to public housing. He received his medical degree from Alberto Mesfer Salvadorian University and has an MPH from Catholic University in El Salvador. So now I'm going to pass it off to Dr. Leon to begin the session.
Thank you, Dr. Cho. Again, good afternoon and good morning to you if you're on the West Coast, and Happy New Year. Happy New Year to all of you guys. We hope that the year 2020 is full of blessing and good work, for the underserved populations that you serve. Before we get started and we have a review of the last session, there are a couple of messages that I would like to briefly mention. First, remember that there is a post survey after this activity, so make sure that you complete the survey. Your feedback is really important, and it is the best way that we have to improve our sessions and get additional feedback from you on what your training and technical assistance needs are. Second, this is, I understand that we have some health centers that registered from Puerto Rico, and Puerto Rico was hit by an earthquake, and it's been having some aftershocks after the earthquake. So for all of you in Puerto Rico who are either on this call or because of the same reason you couldn't participate on this call, I just want to let you know that we are with all of you. Our prayers are with you, and if there is anything that you need on specifically regarding training and technical assistance, please make sure to reach out to us, and we will be able to help you, or I'm happy to help you. And lastly, even though we have this information at the end, I just want to remind the audience that we, the National Center for Health and Public Housing, are hosting a conference in the month of June, and the call for abstracts will be open soon. So if I'm not mistaken, by the end of next week, you can go to our website and you can either register and use the early registration offer, or you can submit an abstract. We would like to hear from you regarding any best practice or promising practice that you would like to share with other health centers, specifically on the areas that we have discussed, or if you are planning to develop the AMIGAS program and would like to discuss it at the national conference, you can submit your abstract, and the abstract will be reviewed, and you will receive a confirmation from the National Center for Health and Public Housing. So those are the main messages that I have for you before we get started. And let's start with the review of the last session. The week before Christmas, we have our colleague Fide Pineda Sandoval, who presented on the AMIGAS program, specifically the toolkit, or that is for the outreach workers of promotoras. We discussed the step-by-step information that is part of the toolbox. Remember that even though this is just for cervical cancer screening, the module or the information can be adapted to provide other types of outreach depending on the needs that you have. Remember that this is the material included in this AMIGAS program is evidence-based. We had a lot of subject matter experts from different organizations providing feedback, providing information, providing their experience on how to address this particular issue, not only in the continental United States, but in the islands like Puerto Rico, for instance. Second, we had a discussion on the challenges that you face when you provide outreach, and I believe that the best people to discuss the challenges are those on the call. You know your population, you know what the limitations are, you know what the challenges are. If you would like to discuss that with us, you can also use the raise hand icon, and your line can be unmuted at any time. If not, you can wait until the end of the session to have the discussion. And finally, we discussed some basic aspects of cultural competency, and some of the main issues or concerns that we have when we provide health education to the Hispanic population. I can mention some of them. In my experience, we have had different activities, providing outreach to the Hispanic population on immunization programs, on nutrition, on breastfeeding, and there are several aspects that you have to take into consideration when you offer the outreach or the health promotion. For instance, beliefs. This is really important. The folklore is something that is all the beliefs that are in the Hispanic population, and it will depend on the country or region that person is from, they have different beliefs, they have different ideas, they have different concepts. The other one is the need that the Hispanic populations have sometimes to have consultation with either relatives or other people who have suffered similar situations, similar health conditions, and sometimes you will hear from them say or stating, I talked to someone who had this problem, and this is the reason why they don't like to do the cervical cancer screening. And then you need to be prepared, and you need to really know and be familiar with all the beliefs on the cultural aspect that is going to affect the way that you promote the screening in your population. Next slide. So today we are going to have a brief discussion on another approach to prevent cervical cancer screening in the Hispanic population. And we are going to have a brief discussion on the HPV vaccine. The HPV vaccine is not part of the cervical cancer screening, but it's another way to prevent cervical cancer. Even though the HPV vaccine is not listed as an activity in the AMIGAS program, we consider necessary to have a brief discussion on other ways or methods that physicians or clinicians have to prevent cervical cancer, and at the same time, those providing outreach need to have a general understanding of the HPV vaccine. Then we are going to have a very brief discussion on other resources where you can find information about the vaccine and education resources for cervical cancer. And then we're going to have a brief review of the AMIGAS program. Next slide. So let's have a discussion on the human papillomavirus vaccine or HPV vaccine. And there are two concepts that I believe are important for outreach workers. First, that there are 3 licensed vaccines, 3 approved vaccines. The vaccines have been approved by the Federal Drug Administration. 2 of them are tetravalent vaccines. The other one is a bivalent vaccine. The name of the vaccines, one is Cervarix and the other one is Gardasil. The Gardasil vaccine have 2, there is a quadrivalent vaccine and there is a bivalent vaccine, whereas the Cervarix vaccine is a bivalent vaccine. What does it mean? It means that the quadrivalent vaccine protects against 4 HPV viruses, whereas the bivalent vaccine protects against 2 HPV or human papilloma viruses. These vaccines are inactivated. What does it mean? And this is a very interesting term that we need to make sure that you somehow understand. And it means that the vaccine doesn't contain live viruses, which is always a concern when you discuss vaccination with patients. Some patients believe that if they receive a vaccine, they can get the disease from the vaccine. For example, right now we are in the midst of the flu season, and I've heard people saying that they do not get the flu vaccine because the flu vaccine makes them sick. That is something that is not true, because the vaccine is inactivated. What does it mean? It means that it doesn't have live viruses, and if the vaccine doesn't have live viruses, then the vaccine you cannot get the disease from the vaccine. So it's the same, and the same principle apply for the human papillomavirus vaccine. These are inactivated vaccines, and therefore you cannot get the infection if you receive the vaccine. There are other live vaccines, and this is another topic for discussion, like the measles, mumps, and rubella vaccine, or the flu mist, which is one of the vaccines that we use to prevent flu, or the varicella vaccine. So these are just some examples, and these vaccines are not recommended if someone is immunocompromised, if somebody has a weakened immune system. But in this case, or if we are discussing human papillomavirus vaccine, the main concept is that this vaccine cannot make you sick, or you cannot get the infection from the vaccine. Next slide. So we are going to briefly discuss the HPV vaccine recommendations, and every time that you have the opportunity to discuss vaccination and specifically how young patients can prevent cervical cancer, specifically those who are not in the age group to be screened for cervical cancer, then this is a very good opportunity to discuss with either the relatives of the patient, the teenagers, the opportunity to get vaccinated and at the same time to prevent the human papillomavirus infection. These are just main topics for discussion. The vaccine is recommended starting at 11 years of age. This is for female patients. It's the same for both vaccines. The vaccine, and specifically the quadrivalent, the Gardasil quadrivalent vaccine, is recommended for boys. The difference is that here the recommendation is that the vaccine is recommended for those who are between the ages of 13 to 21, whereas the HPV vaccine in females is recommended for those who are 11 to 26. However, the Advisory Committee on Immunization Practices recommends the vaccine to vaccinate, or has a statement saying that the vaccine can be provided to those over the age of 21, if these are male patients. And this is a discussion that you need to have with the patient, that even though the vaccine is due to research, or the people who were involved in clinical trials were not patients over the age of 21, the vaccine is not going to cause any harm. But this is a conversation that they need to have with the providers. But it's good information for outreach workers when you discuss potential ways to prevent the HPV infection in the male population. Why is this so important? I mean, you can say, oh, Dr. Leon is talking about preventing cervical cancer screening, and now we are having a conversation about the administration of the HPV vaccine in male young adult or male young patients. And the reason is that, remember that even though the HPV has been associated to cervical cancer, there are other types of cancer that are associated or linked to the human papillomavirus. In the very first session, we discussed that you can have oral cancer, that you can have anal cancer, and this is specifically in high-risk populations like the LGBT population. So those are those are some of the ideas, general ideas that you need to have. The other one is that even though the vaccine is inactivated, when you have people with system or weakened immune system, you need to, or patient need to know that the vaccine may not have the same effect. even though they received the vaccine, because probably the immune response may not be adequate. But the vaccine is not contraindicated. And those are the kind of conversations that you need to have. And as we progress in the conversation now, I will show you some of the resources where patients can get this information, that this is very useful information, and there are great resources for patients that you can use. You know, you can print from the website, and you can use to increase vaccination and at the same time prevent cervical cancer screening or other type of cancer linked to the human papillomavirus. Next slide. So the next slide is we're going to briefly discuss the HPV vaccination schedule. As I mentioned, the vaccine is recommended for patients 11 to 26. It can be given to patients as young as 9 years of age. The vaccine is this is a 3-dose vaccination. If the first dose is given today, the next dose is recommended 1 to 2 months after, and the third one is 6 months after the first dose. So this is the recommended schedule of ACIP, the Immunization Practice Advisory Committee doesn't recommend any accelerated schedule. Sometimes there are some vaccines that you could give in a short period of time if you want to complete the vaccination, but the HPV vaccine is not one of them, and it's not recommended to accelerate the immunization part. Then we need to make sure that the vaccine is, you don't have to restart the series if by any reason a patient receives the vaccine and the patient or the patient forgets to receive the second dose at the recommended time interval, like 1 to 2 months after. And this is a very frequently asked question when you have patients, when you have some clinicians asking, do I need to restart the vaccination schedule if the patient received the first dose and then he didn't come to the second visit and the first dose was given 6 months ago? The answer is no, you don't have to. Just make sure that the patient received the second dose and then follow the recommended schedule, which is 6 months after the second, the patient can receive the third dose. And this, again, this is information, a general information that you need to keep in mind when you have conversation with your population, specifically because patients are going to ask you these kind of questions, and the recommendation is to refer the patient to the clinic or to the provider, but you need to have some good understanding on what's going on what the recommendations are, so you can get or you can the patient can trust you. You know, when patients are or receive guidance and the patients see that you somehow are familiar with the topic, they tend to trust you, and trust is very important when you do all the outreach. And then the other concept that is very important here is that the vaccine doesn't have anything to do with previous or current infection or lesions. If someone has history or has current HPV infection, the vaccine is not it is not a treatment, it's not an antidote, it's not going to cure the current or previous infection. In fact, the recommendation is, and this is another frequently asked question when you have conversation with patients or with your population, they will ask, you know, I have history of HPV infection, can I still get the vaccine? And the answer is yes. And the reason is that probably they were infected or they got contact with one of the strains of the viruses. But remember that the vaccine is a quadrivalent vaccine. It means that protects against all the 3 strains or the bivalent, at least the 2 most frequent types of HPV infections. So the answer for that question is yes, even though you have had history or you've been infected previously with HPV, you can still receive the vaccine and you can still benefit from the vaccine. And then there is no pre-vaccination assessment necessary. It means that sometimes you are going to get questions like, I have history of HPV or do I need to get screened for cervical cancer before I receive the vaccine? And the answer is no. If you have history of HPV infection, or if you believe that probably you were at risk or you may have been exposed, there is no need to get screened. The recommendation is to receive the vaccine. Next slide. And then we are going to have I'm going to stop for a moment and see whether there is anyone who would like to discuss any of the topics that we have had so far. And this is just a quick feedback from anyone who would like to either discuss the HPV vaccination or anything regarding the AMIGAS program. So I'm going to stop for a moment and let me know, Chantel, if somebody has any question or type any question, or if somebody wants to chime in and provide some feedback. Let's wait for 30 seconds, okay? Any questions in the queue or in the chat?
Not at this time.
All right, so next slide. All right, just to recap, remember that this is a vaccine that is recommended for male and female patients. That is one of the main or one of the highlights of this of today's discussion. Second, that this is an inactive or inactivated vaccine. It means that the vaccine doesn't have live viruses, and therefore the vaccine, you cannot get sick if you receive the vaccine. Third is the vaccine is recommended for very young patients, even before they can get in contact with the HPV virus, or get an HPV infection. And this is a vaccine that doesn't have side effects or generalized side effects. There are some contraindications to receive the vaccine as any other drug. First, if the patient has history of any allergy to any of the ingredients or components in the vaccine is not recommended. Second, the vaccine gives some localized side effects, like any other vaccine. You can have pain, you can have redness at the injection site, but you can have a low-grade fever, but that's it. I mean, the vaccine has not been associated or linked to any other generalized side effect. Those are the main takeaway points that I would like you to keep in mind. First, you have an inactivated vaccine. Second, can be given to patients as young as 9 years of age, even though the recommended age is 11 to 26. Third, that can be used in female and male patients, specifically one of the vaccines, the quadrivalent HPV vaccine. And lastly, that there are not severe side effects from the vaccine. Next slide. And then I would like to address some of the main questions that you can get from your population. Specifically, you're going to have a conversation about HPV in general or HPV vaccination. And the first question that is a frequently asked question is whether or not girls or women should be screened for cervical cancer before getting the vaccine. As we previously discussed, the answer is no. The vaccine is recommended even if the patient has history of previous HPV infections, or if the patient has developed a lesion, like a papilloma or any other lesion, the vaccine is recommended. Remember that this is a quadrivalent vaccine or a bivalent vaccine. The vaccine is protects against the most frequent human papilloma viruses. So the answer for this question, if you receive this question from one of your patients, is should I get screened before getting the vaccine? No. And then you can give that explanation, and you can refer patients to the resources that we are planning to share with you. Next. This is another frequently asked question. The question is whether or not the vaccine is recommended during pregnancy. And the answer is no. The vaccine, even though, again, the vaccine is an inactivated vaccine and therefore the vaccine cannot cause the infection, the vaccine is not recommended in pregnant patients. If somebody started the series, for instance, and the patient received the first or the second dose, and then the patient gets pregnant, then the recommendation is to wait until pregnancy to receive the third dose. Remember that there is no need to restart the series. The patient will need only the third dose of the vaccine, and then the immunization schedule will be completed. Or if the person is pregnant and the person hasn't received any of the doses, and you get a question like, can I get the vaccine? The answer is no, and just wait until you have your baby so you can start the series. And even though the vaccine is not going to cause any harm to the fetus, the vaccine is not recommended. Next slide. This is another question and these are frequently asked questions. These are questions that we've taken from different clinics, different resources. CDC has a list of frequently asked questions on its website, on partners' websites, where you can get information, because regarding this topic. And another question that is very often asked by patients is about the how long the protection lasts. The answer is that it is a long-term protection. You don't have, at this moment, there are no recommendations to revaccinate any patient. So if the patient has completed the schedule, the vaccination schedule, the patient doesn't need to receive any additional dose of the HPV vaccine. Next. And this is another question, and this is a question that I'm quite sure that you may receive either at the clinic or when you are providing some outreach, and is whether or not the vaccine is covered by insurance plans. As the vaccine is covered by most of the insurance plans, and even if the patient is under-insured or has no insurance, as many of the patients or the populations that you see, you can contact the Vaccine for Children program in your state and get information on how the patients can get the vaccine for free. I'm quite sure that the person who is responsible at your health center may have additional information for your patients. And remember that this is just general information, and you have to refer to your patient back to your clinic or to the provider to get additional information. Next slide. Another frequent question is regarding whether or not, if you have received the cervical cancer vaccine or the HPV vaccine, you still need to get screened for cervical cancer. The answer is yes. Remember that the vaccine protects against 4 strains, but the vaccine doesn't protect against all the strains. So these are the most frequent strains that can cause cervical cancer, but the patient will always need to get screened for cervical cancer, even though they have completed the HPV vaccination. Next slide. And then this is a conversation that you need to have with anyone that you are discussing any sexually transmitted disease. Remember that the HPV infection is sexually transmitted, as is syphilis, gonorrhea, or any of the other STDs. And you're going to get questions like, is there any other way, or are there any other ways to prevent HPV? And then this is the best and probably the only opportunity that you will have to deliver the ABC message. So remember, and you need to make sure that the patient understands the ABC. And ABC stands for first, abstinence. You need to be, I mean, if you don't want to get any of these infections, abstinence is one of the possibilities. The B stands for be faithful. Remember that this is a good opportunity to remind patients to be in a monogamous relationship. You know, and if there is no way, you know, to be in a monogamous relationship, then the C stands for the use of condoms. So the ABC message is you need to remind the patient, you know, and discuss with patients without any problem or remorse, I guess. You know, sometimes we are afraid of discussing this topic with patients, and sometimes we try to shy away and say, this is something that I should say, but I prefer not to. And remember, the ABC message is, remember patients about abstinence, remember the patient about to be faithful, and the use of condoms. Next slide. Now we are going to now move over to the second learning objective for this session, and we are going to discuss some cervical cancer outreach resources. Remember that these slides will be shared with all of you, and you can also go to our website, www.nchph.org, and get information on other resources where you can get information about outreach and how you can get additional resources for your patients, either for the Centers for Disease Control and Prevention or any of the organizations that we are listing on this slide. Next slide. Again, you can just visit the Centers for Disease Control website. You can also visit the American Cancer Society website. You can go to NIH and get additional resources for your patient. Before we move to the next slide. Chantal, can you pull up the site, the Immunization Action Coalition site? Thanks. And I will, I'm going to stop for a moment, and I'm going to try to show live this site. This is the site of the Immunization Action Coalition. You can find information on all the licensed type vaccines in the United States. Specifically, this web page is for the HPV vaccine, and you see that they have different resources that you can print from the website. You can have vaccination information statements, what you need to know, and other useful resources that you can share with your population. At the same time, there is a section that I really like, which is Ask the Experts. And these are the, can you please click on that one? And if you see, these are some general questions that CDC and other subject matter experts receive on the HPV vaccine, and the way that you can answer these questions. So this is a very, very useful resource, and you can get different tools, you can get different vaccination information, not only for the HPV vaccine, but for the other licensed vaccines in the United States. So if I'm not mistaken, and if I'm reading it right, it's www.immunize.org/HPV, human papillomavirus, and then you will go to all these resources. Again, these resources will be shared with all of you at the end of the webinar. And then next slide, I believe that we have a poll question. Next slide. There we go. And this is a question, and the question is, why is it so important to promote cervical cancer screening among Hispanic females? And you have three options. A, cervical cancer has a high incidence in the Hispanic population. B, language can be a barrier for understanding instructions from providers. C, cultural beliefs can be a deterrent to cervical cancer screening. And D, all of the above. So let's wait to answer. Let's we are going to test knowledge and see what your response is. 30 seconds. All right. Can we get them in this one?
100% of participants voted all of the above.
Excellent, and that's the right answer for the question. Thank you so much. Next slide. All right, let's do a recap of the AMIGAS program. Remember that this is a bilingual toolkit that is being tested multiple times, that has a task force involved. Subject matter experts develop content based on feedback that they receive from private and clinics and FQACs around the nation to provide information or education to Hispanics on cervical cancer screening. And this is a bilingual resource. It's in Spanish and English. Remember that cervical cancer screening, the incidence is higher among the Hispanic population, and that's the reason why you have to provide cervical cancer screening education to your patients. And at the same time, again, this is a program that you can adapt for all their and use it, to address or modify to address some other concerns. Remember that cervical cancer, when you discuss cervical cancer with patients, there's always a good opportunity to discuss for breast cancer, for instance, breast cancer screening, and whether or not the patient has been screened. So this is a very good opportunity to start a discussion on a particular topic and take advantage of it and discuss another health topic, that may be a concern in your community. Next slide. Remember that this is a education tool that provides all this information, in regards to cervical cancer screening. Again, provide cultural appropriate and bilingual information, uses the most of the up-to-date information on cervical cancer is always reviewed by subject matter experts that you can easily download from CDC website. And there are any other updates, then you will be able to get all these updates from the CDC's website. Remember that if you visit this page, you can subscribe, and when you subscribe, you can get any information if there is any changes, or if there is any version, or if there is anything else. Sometimes you can receive emails or information that there is an error, a grammatical error or something else, and then you can make sure that you are addressing all that. But remember that even if you download and use the materials, it's always a good idea to once in a while visit the website, the CDC's website, and see whether or not you're using the most up-to-date version of the AMIGAS program. Next slide. Then the components, remember that this is a toolkit, has different resources. There are two in particular that I would like to mention. One is the book or the information for the outreach workers. The other one is for the administrative staff. For the administrative staff, you can get information on how to implement the program, and at the same time, you can develop some cost analysis. This is always very useful for someone who's trying to implement a prevention campaign in the community. The promotoras toolkit has the information on how to develop the education in the population, and then you have CDs, resources, frequently asked questions that you can use as materials that are part of this cervical cancer screening program. Next slide. Again, you have the administrator's guide that I mentioned. The reason why it's so important for administrators to have a very good understanding of what the program is about. You can do some cost analysis. You can see whether or not this is feasible in your community, and if there is any need. This is a very good opportunity to have your clinical staff involved, or your board, and explain to them the number of patients, female patients that you have, the number of patients that need to be screened, how you're doing with the quality improvement measure, and whether or not this is a solution to the issue. Next slide. And then again, you have the instruction guide. This is a step-by-step booklet on how to develop the program, and has other materials, educational materials that you can use. Remember that this is cultural competent program that has been developed. That is a bilingual program that you can use, and that you can somehow adapt, to promote any other preventive measures in your population. Next slide. And then we have some Some other tools that we can use. Remember that this is that if you would like to address these issues and you would like to get more information, you can visit our Moodle website, and then, or you can visit our website nchph.org, and then you can download or get additional information on these, including the slides, the recording, and anything that you may need if by any reason you missed one of these sessions. Next slide. And then we are going to do the Q&A. If there is anybody who has a question, please either type your question in the question box or use the raise hand icon and the line will be on you. Any questions?
Not at this time.
Right. Well, in the meantime, can we move to the next slide? And then come back to see if there are any other questions. Remember, in the very beginning, I provided some information about our national conference that will take place in Alexandria, Virginia, June 18th and the 19th. We are looking for best practices on any of the outreach work that you've done. And if you would like to submit your call for abstract, please make sure that you do it. We are going to open the call for abstract next week. So at the same time, we are going to provide information on the emerging issues affecting public housing residents and other special populations. We are going to cover diabetes, programs on how to increase access to care, best practices on quality improvement, information on social determinants of health, two main programs developed by HUD, the smoking cessation, the ban prohibiting the smoking in public housing, and the ambition centers, which are two of the main priorities, HUD priorities, as well as we are planning to cover the HRSA priorities. So this is going to be a very extensive and at the same time popular, I guess, webinar topics that we can discuss that we are going to discuss at the conference. So if you have anything on cervical cancer, diabetes, or any of the other health condition affecting your population, make sure that you submit your abstract. Any questions? Chantal, Vicky?
No, we do not have any questions.
All right, next slide. Remember to please complete the survey. At the end of this webinar, you can join our mailing list. You can receive information on HRSA updates and priorities. You can get information on upcoming webinars, conferences, and any of the emerging issues affecting special populations, or any other. You can also go to our website, and if you need technical assistance, you can complete the form. We are going to make sure that we answer any of the requests in 48 hours. Next slide. And again, visit our website. You can find all this kind of information, publications, webinars, learning collaboratives, health issues affecting our the special populations, or any other topic concerning health center programs. So next slide. Because I had a very shy audience today, make sure that if you have any questions, You can also contact us. This is our contact information. You can email me. My email is jose.leon@nmgt.com, or you can contact any of our staff members, and we will be more than happy to help you with any of your questions or concerns. So thank you so much for participating in this activity. Again, if you have any questions, please do not hesitate to contact any of the staff members. Or if you would like to hear from us regarding any other topics affecting your population, make sure that you send us that information. Thank you. Have a great afternoon. And for our friends in Puerto Rico, be strong, and our prayers are with you, all of you. Thank you.